Light rays enter the eye through the cornea, pupil, and lens. These light rays pass through the vitreous, a clear gel-like substance that fills the middle of the eye. The light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The macula is a very small area at the center of the retina that gives us our fine, pinpoint central vision. The area of retina surrounding the macula gives us our peripheral or side vision. The retina converts the light rays into signals that are sent through the optic nerve to the brain. With non-proliferative diabetic retinopathy, or NPDR, damaged blood vessels in the retina begin to leak fluids, including small amounts of blood, into the retina. Sometimes deposits of fats may leak inside the retina. These deposits are called hard exudates. With macular edema, fluid leaking from the retina's blood vessels can cause the macula to swell or thicken. Because the macula is responsible for our central or pinpoint vision, macular edema interferes with clear vision. Macular ischemia occurs when small blood vessels close. In this case, your macula is affected because it no longer receives enough blood to work properly. For macular edema, the laser is focused on the retina around the center of the macula. The laser is not applied directly to the center of the macula, as this would reduce central vision. The main goal of treatment is to seal off leaking blood vessels that interfere with proper function of the macula. With PDR, many blood vessels in the retina close, preventing adequate blood flow to the retina. The retina responds to this problem by trying to grow new blood vessels. However, these new abnormal vessels do not provide proper blood flow. They can also bleed as well as lead to scar tissue, which may cause the retina to wrinkle or even detach. If similar vessels grow abnormally in the front of the eye, they can block the drainage channels of the eye and cause high pressure and possibly glaucoma. Both central and peripheral vision can be affected by PDR. With laser surgery for PDR, the laser is applied to the peripheral retina, avoiding the central macula. This laser treatment, called PRP, or panretinal photocoagulation, and also known as scatter photocoagulation, causes the blood vessels to shrink and often prevents them from growing again in the future. It also decreases the chances of the blood vessels bleeding into the vitreous or causing a retinal detachment.
Multiple laser treatments may be necessary, but despite having laser surgery, some people with PDR may still develop further problems. For instance, the abnormal blood vessels can bleed into the vitreous, the clear gel in the middle of the eye. This bleeding, called the vitreous hemorrhage, can prevent light rays from reaching the retina.
Vitrectomy surgery is usually performed in the operating room on an outpatient basis. An operating microscope and small surgical instruments are used to enter the inside of the eye. Blood and scar tissue are removed. At the same time, a laser may be used to prevent further bleeding and abnormal blood vessel growth. To help the retina heal in place, the ophthalmologist may place a gas bubble or silicone oil in the vitreous space. The gas bubble will gradually dissolve on its own. Removal of the silicone oil requires an additional procedure. Use of a gas bubble or silicone oil is reserved for eyes with retinal detachment or advanced scar tissue. After vitrectomy, the results of your surgery may not be apparent for months.